topics and opinions expressed in the following show are solely those of the host and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Dallas Fort Worth. Welcome to another Ask the Expert show where we bring you, and I mean the finest experts in the field of legal, health, financial, and home improvement. This is the last Wednesday of the month. This is a show that I look so forward to doing. We've been doing this show for several years. It's Elite Care Clinic, and I got to tell you, we get so many emails about this show. I got to tell Dr. Gamboa, first of all, she has got this huge group of people who just love the show. They know it's going to come on last Wednesday of the month at 4:25 Central Time. Let's welcome, is Dr. Gamboa with us?
Hey, Steve, how are you?
There she is. Gosh, you're becoming this like superstar. Forget the Dallas Cowboys. Yeah, we got Dr. Gamboa. And I got to tell you, I've been doing this show for 15 years. I've never seen a show like this where people just write in, just telling us. Mostly I say, I've never written a letter like this before, but I love Dr. Gamboa's show. And it's, I think what it is, people just can tell you've got such a heart for this, Dr. Gamboa.
Thank you. And that's what I want, to educate people. I think that's the clue of everything, if you understand what happens to your body, what we can do to prevent something, or the chronic diseases that are like we know, like diabetes, high blood pressure, and we can do something to prevent it, then I think like nowadays, like we are more aware of these things. Nowadays we are more like, hey, I don't want to just take a pill for everything. I want to do something before I develop this, and what can I do to prevent this? So that's the idea of this platform also. And I'm so humbled, and thank you so much for all this, because I love this. This is what I want. It's like to get more people to understand, to be more aware of their health, and also like, hey, I want to have a good quality of life whenever I'm going to be 60, 70. I don't want to have a stroke by that time. I don't want to develop diabetes by that time. So that's what the whole purpose, of this. And thank you for bringing this platform to me to like help.
Well, something, Dr. Gamboa, that I got to tell people, because we've been doing this for 15 years. This show has become so important to the Ask the Experts family that we do a live show, and then we replay the show 3 other times in different slots during the month. That's how important the show is, because you practice what's called functional medicine. And
right.
We're going to get into that because a lot of people don't know what functional medicine is. And I got to tell you, Dr. Gamboa, I totally believe so much in functional medicine, because I've actually had friends of mine that go, I'm hurting, something's not right with my body, and my doctor says I'm fine. Well, now, so what do you do? What do you have no, you think you have nowhere else to go, but this is the kind of patients that you love seeing, isn't it?
Yes, because like as functional medicine, it's so critical nowadays, because it's more like a personalized thing. It's trying to get to the of the problem. And that's what I always preach, instead of just putting a band-aid on it, just giving you a pill for something, and it's so important to like understand this. It's just the whole body works in harmony, and the whole thing is not just compartmentalized medicine that nowadays we do this. So no offense to any of the specialists, but most of them is okay, like the heart, mostly on the heart, the kidneys, but then how do we put everything together? How can they talk all together and then, hey, come up to a solution? What's going on? Okay, like if you're having high blood pressure, okay, so what else can the blood pressure damage? But how can we prevent this so that all the other organs are not damaged, So those are the how we think and how this is becoming more and more like popular, People want a different way of treating the chronic diseases.
Well, what makes your show so easy is because we get so many letters, people having questions for you. And I was going to ask this to you last week. Um, we just ran out of time. I just wanted to make this the first question. We had a young lady out of Fort Worth wanting to know what of the new skinny injections do you think is the best one? Because there's about 4 or 5 out there.
That's an excellent question, especially, with a lot of not only the branded name, but the compounded now are being less and less because a lot of the skin injections, how we call them, like the Wegovy or the Zepbound, they are out of the FDA list of like that. They are not in shortage anymore. So whenever this happens, so like compounded pharmacies are not allowed to continue like producing these injections, and there is a whole big issue with that, like with the companies, and they're being like suing the big companies to the compounding pharmacies and all these problems. But like, which one is the best one? Honestly, it depends on your body, because like I had patients that they did great with one of them. Like let's say the first ones that was in the market, like Wegovy, they did awesome, and sometimes they don't do that great. And it all depends on your receptors. It all depends on like also like it depends on how engaged you are or to make health changes, because it's not only depending on an injection for like the weight
Right.
loss. You have to make the decision that this is a different way of living now. It's not a diet. Do not call it diet. Like just take that out of your vocabulary. But this is more like a healthy way of living. Like your health. You have to make healthy choices nowadays. It doesn't mean that you're only going to be living with lettuce, or water, but you can do everything you eat, but you can look for the healthy choices. You can do for example, like ice cream. If you love ice cream, you can find the ice creams that has less calories, less carbs, but you're still enjoying your ice cream. You still have that joy of like eating that creamy stuff, but without all the extra sugars, all the extra fat. So you have to like make the decision to like eat healthy, because no matter what, even if you have the bariatric surgery, even if I give you the best medication in the world that in the trials have shown like that you have 20+% of weight loss, but if again you don't make the decision to like eat healthy and do more exercise, nothing is going to work. So like in the answering which one is the best, it depends on the patient, their receptors, and again like how much changes they're going to do. Because if they continue like injecting themselves and they're still drinking sodas and they're like having a
Right.
lot of sugar and things like that, it's really not going to help you.
Which one do you have a particular one you use?
Like I have a little method, I would say, like there's a little madness to my method. So I try to start with the one that is, because like with to understand the injections is like two different types. One is the older generation, like I think we mentioned that before, it's only one peptide, and the other is the newer generation that are like two peptides. Of course, two is going to work better than one. But what I always try to like explain to the patients is, hey, let's just start with the one. And whenever you hit a plateau, whenever like there's no more weight loss or like it's not working as well, then we can switch to the other. Because if I start with the best one with the two peptides all at once, yes, you're gonna have like weight loss, But what are we going to do whenever this hits also the plateau, or like there's like nothing else to offer you? So it depends on the patients how much weight they have to lose. But that's kind of like my method, so to speak. Like there's nothing written that you have to do first and the other. There are doctors that they start right off the bat with the two peptides, because also some patients come to the office requesting the medication by name. So you're like, okay, so like I like to do more education and say, hey, like, yes, this is what you want, but probably this will benefit you better. So why don't we try this first and then we can. So it depends on that.
So I'm one of those people that is not embarrassed to say that I'm on Ozempic, but I've learned a lot of things, Dr. Gamboa. Um, it got to a point, and I want to bring this up because there's negative stuff in the news about these skinny injections, and this is right from the horse's mouth. But I found that after about a year, it was no longer working for me. Now, I was giving the injection in my stomach, and my doctor said, because I'm in Florida, gosh, if I was in Dallas, I would be coming to your office. But my doctor said, try putting it in your arm or your leg. Now, I got to tell you, it sounds scary giving yourself injection. You don't even feel it. There's so many times, Dr. Gamboa, I have to look to make sure I've actually
Yeah.
injected myself because the needle's so small. But when I moved it over to my leg, it started working again. Is that unusual?
It's not unusual, Steve, because what happens is that if you think about this, it's the same concept of whenever you've been using insulin for so many years. What happens? Scar tissue happens. So then if you have
Ah,
scar tissue, then it doesn't absorb as much. So if you try to do it in different areas, even though you have rotated, right? But still,
yes,
after using it, as you said, for a year, like every week, so of course there's going to be some like scar tissue. Same thing happens to like the diabetics who use insulin. So we try to like see, okay, like let's see if it's gonna work if you're going to like change it to like your arm or your leg, and see if that's going to be better. And if it is still working, like then great. And you mentioned like I just want to like also educate patients about this. Whenever you mention that, yes, there's like some bad reputation now, like or like all these adverse effects that has been happening. But I would
yes,
like let patients know that when these injections are done by physicians that really know how these medications work, not by the esthetician, not by the barber, not by all these other people that all of a sudden became experts in this like injections that they
yes.
started giving you. Like I see a place in the mall where they go ahead and do semaglutide. They offer semaglutide, and most likely it's not even uh, a physician doing that, like so physicians like, for example, myself, that I'm a diplomat of the American Board of like Obesity Medicine, endocrinologists, they patients, doctors that are knowledgeable on this. And if you follow like the instructions and all that, you are very, very, very tiny times that you're going to have an adverse effect. And what are those? Most of the times is constipation or maybe a little bit of nausea. But those are the
Yes.
most severe like adverse effects that we see if you are following the instructions, if you are doing this the right way, with a doctor that knows what they're doing, or the one that is a physician, that is knowledgeable on this. So that's why like there was a lot of social media issues too, because people started using it there higher doses to think that it was going to work better. So with higher doses they were like having severe adverse effects, because these medications can cause severe adverse effects if we don't use them correctly. If I give you higher doses because I want you to lose weight faster and I don't go through the titration, then you can have severe constipation, and that can put you in the hospital, because then you have impaction. Like you can have a blockage. If like you have severe nausea or vomiting, you can go into dehydration. So,
Right.
or like if like you are still injecting this and drinking a lot of like alcohol, you can develop pancreatitis. That's an inflammation of your
Ah,
pancreas, and that's one of the possible adverse effects in the black box warning on this injection. But again, if you do it the right way, like you don't have like severe side effects, like sometimes you may develop. And also again, you have to be with a doctor, because if a doctor notices that you're having possibility of gastroparesis, that means that it's like slowing of the emptying of your stomach, the doctor is not going to continue giving those things thinking, oh yeah, it's going to go away, keep using it. No, we're going to stop right away, make sure that it's not an adverse effect of the medication, or maybe if you were a diabetic, you were already having some degree of this problem, because that can happen because of the damaged nerves around the stomach that helps with the motility. The same way as the diabetes damages your nerves on your feet, the same thing happens in your stomach. And maybe this aggravated it, like this can worsen, because remember, these injections make your stomach slower, the slowing down the emptying of your stomach. It makes your food stay longer so that it can give the signals to your brain to say, hey, I am full, no more food for me. But again, it takes a knowledgeable doctor to help you go through all this.
Dr. Gambo, I think about you all the time when I see these commercials on the internet, on TV, order your the skinny injection. But if you actually, which I totally believe, everybody's body's different. How can you have someone sending you something through the mail who's never even looked at you before, who knows nothing about, they might ask some questions, but it's so important, I think, that you go through your doctor and not go through well, I tell you what, I'll never get one of these people expert on my show, but don't go through these companies that advertise on the internet.
Yeah, it's a scary, Steve. And also, a lot of the times, yes, like even though these platforms, they may have nurse practitioners or even physicians that they may be knowledgeable, but a lot of the times you cannot build a whole relationship only like through like virtual. They don't know you, as you said, like well enough. Yes, they can ask you questions, but a lot of the times patients also may not tell all the truth to get the medication. So like that's something also that can happen. So I always believe in, like, again, personal relationship, like patient physician relationship. I know you, I know what we're doing. And whenever you build that, it's perfectly fine to do a virtual follow-up, and then I can see you in 6 months, but I can do like a follow-up in 2 months virtually, or like every 2 months. But that's the relationship that you build. That is very important. And also the other thing that is very important for the patients to know is be careful about if the price is too good to be true, then probably it's not a good one.
Yes.
Because, the thing is that I've heard that they have been fake Ozempics, even though they look
Ah,
exactly the same. They're coming from Brazil, they're coming from South America, they're coming from China. They're exactly the same. And it's very difficult now to notice the difference because of like all this Photoshop, all this like quality of the pictures and everything, and the
right.
printing that we can have. But the only thing that really like you can tell the difference is because of the lot number. It's non-existent whenever it's that. So that's because like
Ah,
you don't know what you're injecting in yourself. It could be insulin. They found insulin in some of this pen. So be very, very careful to like not be getting it like cheaper from Mexico, from Brazil, from places like that, because you may not be getting the real thing, and
right.
you may be putting yourself at risk. And that's whenever sometimes they develop the adverse effects, because you don't know what you're getting. And unfortunately, they're like, oh, it was Ozempic. But in reality, it was something else. So just be careful about that.
One thing I got it to, we're talking negatives about these skinny injections. I just got my blood work done, and I got to tell you, Dr. Gamboa, my blood work has never looked as good. I even had real high potassium, which is dangerous. Even my potassium was way down. And the only thing I can contribute it to is the skinny injection. I think there's a
Well,
lot of good things that they haven't discovered yet, because I know they've been talking about they think it helps with cardiac patients.
oh yeah, like so especially like like the semaglutide, like that's the Ozempic one. That's the one
Mhm.
because it's older in the market since 2017. So we have more data from there. So we have like all the data that it helps with decreasing the risk for like heart attacks and strokes,
Mhm.
like decreases like the second is a secondary reduction of this events, because if you already had a heart attack or a stroke, then if you use the Wegovy, then like decreases your chances of getting another one, like. So the other thing that they found now with the Ozempic is that it also helps with CKD, that's chronic kidney disease. So like it decreases the progression of like chronic kidney disease. And then those are great benefits that you have, like aside from the benefit of losing weight, and losing weight like gives you an extra layer of benefit. These molecules by themselves are helping you. And the new thing that is coming is that the new indication may be is that it helps with fatty liver. For the longest, there was no treatment for fatty liver other than weight loss.
Ah,
But also this one's on top of the weight loss helps with decreasing the amount of, they're seeing that the initial things that decreases the possibility of fibrosis. So that's awesome, because like fatty liver is one of those things that we didn't really pay much attention to it for the longest. But later on, we learned that unfortunately it causes the same irreversible damage that alcohol does to your liver. So it can cause cirrhosis, and then that can happen. And then later nowadays, like the first the cause number one for like liver transplant used to be like very high the alcohol, but now it's the fatty liver. So that's why we have to be very careful also about obesity and fatty liver, because that can cause all this fibrosis because of the constant inflammation, because of the fatty infiltration of the liver can cause all these problems.
gotcha. Can't believe I'm looking at the clock. We've only got a few minutes. Dr. Gambo, can you tell people, we had so many people wanting to know about what supplements you ask your, they just showed us we got 3 minutes left. They wanted to know what supplements that you like to have your patients on. I know multivitamin is very important.
Yeah, like especially if you're losing weight, for sure you need a multivitamin to replace all like these nutrients. But again, like it's mostly like I like to check some vitamin levels on my patients. Like if their iron levels are low, there I'm going to add
Mm,
them like some iron. If like their vitamin B12 is not optimal, I'll definitely add extra vitamin B12 more than the multivitamin, because remember, multivitamin they have a tiny amount of everything. But if
right.
you are lower, we need to optimize your levels. Vitamin D3, vitamin K2, I love. Then the iodine, depending if they have like thyroiditis or Hashimoto thyroiditis, history of that. Then I do like, depending if they are on hormones, then I give them what we call DIM. This is a powerful antioxidant that comes from the broccoli, the kale, all that family of cruciferous vegetables. That is a powerful antioxidant, helps also with the hormones, the metabolism of the hormones, and also helps with the SHBG, that's the protein that transports the hormones. If it's too high, it traps your hormones, you don't have enough for your circulation, but then this one brings it down. So many other things, and it depends. Again, it's more like a personalized thing. I don't give like this A to Z like supplements to everyone. It all depends on what you need and what we can help you with. Or if we need to help you with stress, like to decrease your cortisol levels, then I recommend the supplements that we have, that they are called Relora. That has been shown that they decrease your cortisol levels. Or if you're having too much anxiety and you're not able to sleep, that also helps. But then I add something called L-theanine that comes from the green tea, that helps with the anxiety, irritability. So there's so many things that we can do. But again, it's more personalized, and we try to like say, okay, what do you need? This is what we're gonna do.
I promise everybody we got so many texts, people wanting us to do a show on hormones. I
Yeah,
promise you next month we will do a show on hormones.
let's talk
That's one
about
of
all
your
hormones.
specialties. How
Yes.
do they tell people how do they find your website?
So it's like www.elitecare-clinic.com.
Make sure you put that dash in there.
Yes, you have to do the
Right?
dash.
Make sure you
Yes.
make sure you do the dash. And Dr. Gamboa, God, your show goes by so fast. But hey, Doc, we'll be replaying this show over the next 3 weeks, and Dr. Gamboa will be back again with us next month. Thank you so much, Daniela.
You're welcome, Steve. Thank you so much. And again, thank you everyone for listening and giving me the opportunity to help you learn a little bit more about what functional medicine is, personalized medicine, prevention of the chronic diseases.
You're a superstar. We love you.
Thank you. Thank you.
Thanks so much. That's Dr. Daniela Gamboa. She's been with us for several years now. She'll be back again next month. She's amazing. That's it for us today. We'll be back again with you next week with more Ask the Experts. Thank you to the sweetest, most knowledgeable producer, Rebel.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.